Houston has seen some hazy skies recently. Experts are blaming it on the agricultural fires in Mexico and other Central American countries, something that they say is actually pretty common for this time of year. Dr. David Persse, Chief Medical Officer for the city of Houston, joining me now to talk about how this haze could impact your health. Good morning, Dr. Persse.
Good morning, Haley.
So first, tell us this haze. So I guess we are seeing it from fires. And is this something that you would say that typically happens this time of year? I mean, in your memory, can you remember this happening before?
Yeah, it happens every year. I mean, this agricultural burning happens every year. Now, not every year does the wind blow it all the way up here to Houston, but this does happen, from year to, sometime one year, maybe yes, one year, maybe no, but we certainly got it pretty good this year, that's for sure.
Yeah, we did. And so really, what is the difference between that type of haze and pollution? I mean, is it going to do the same thing to our lungs?
Yeah, so that's a good question. So on one hand, haze is kind of a slang term, right? So it's when the particles in the air, whether they be from agricultural burning or a forest fire or from whatever source, is thick enough that it actually can absorb some of them of the sun's sunlight, making it look hazy out there. When we talk about air pollution, the classic kind of air pollution that we worry about here in the United States, tragically, often that isn't hazy, and it's there and you can't see it. So while haze is bad, at least you see it and it gets your attention. Air pollution, the classic air pollution that we deal with here in a modern industrialized nation, is sometimes, purely invisible to us. And so it's there and it's harming us or potentially harming us, and we don't even know it's around.
Yeah, so on the side of our screen right now, we're looking at some of the haze, which just looks like a white screen. It looks like almost a mistake on the screen right now, but it is creating some like whiteout conditions. What are the potential impacts of breathing this in?
Well, there's a number of things. Depending on the source of the air pollution or the haze, there will be different things in there. So we worry about the combustion products, whether it be agricultural burning or from an industrial sort. And so there are things like nitrogen dioxide and sulfur dioxide, all these other chemicals which are harmful to you. But there's another thing that's sort of common to all of them, and in particular to the agricultural burning or forest fires. And these are things that are called PM 2.5. And these are just particles, they're not necessarily a chemical, but they're super tiny. They're less than 2.5 microns in size. They're too small for you to see. But they're small enough that they not only, when you breathe them in, they get past all of our normal defenses. They get deep into the lungs, and they actually get into the blood system. And when they're in the blood system, they then irritate the lining of your blood vessels. And this can cause really serious problems, including heart attacks and stroke. And so while we think about air pollution causing exacerbations of our asthma or our emphysema, which absolutely happens, we often don't think about the fact that it actually gets into your blood system and causes heart attacks and strokes as well.
Wow, yeah. So we're not just talking about this being limited to those who have lung conditions like asthma and COPD. This really does affect everybody.
It really does. And here's the thing, is that for those folks that have got asthma or they've got COPD, on days like this, they already know that they need to do things to take care of themselves.
Sure.
So the things that they will do is, number one, they should make sure they're on their chronic medications. Number two, make sure if they need a rescue inhaler that they've got it, right, and that it's ready to go. And if not, go to the pharmacy and get a replacement. They may think about staying indoors, and if you have to go outdoors and you want, these are the folks that you'll see wearing the N95 mask that it screens out 95% of the particles, unfortunately not 100%. For the rest of us who think that, this is no big deal because I'm healthy, well, today you might not have a problem, but after years and years and years of this, it can cause problems. It's a cumulative effect. So even those of us who are not asthma patients, we need to pay attention to the air pollution around us.
Interesting. Yeah. Is there anything that we should be doing, like when we're in our cars? I know we've got air conditioning pumping now. I mean, should we be concerned about letting outside air in?
Well, the one thing that you can do in your car is on your dashboard, in your air conditioner, there should be a button to let you recirculate the inside air.
Yeah.
And you should probably engage that. That's what I do, so that it recirculates my inside. First of all, it makes my air conditioning a little bit, gets things cooler faster, because I'm not constantly trying to cool that super hot outside air, but it makes me a little bit more comfortable, a little bit more quickly. But also, it circulates the inside air. And then the other thing is that make sure that your filters get changed regularly. Whenever you get your oil changed, make sure they check your air filters for for your air conditioning and see if they need to be replaced.
Yeah, I mean, I think that's really a really good point because it's starting to get hotter, and now we've got, the air quality is quite a concern. And then if people do start to experience what they think are breathing problems or something like that, what should they do?
Well, first of all, prevention if you can. We've already talked about a couple of important things to prevent. But if you're starting to get in trouble, you should call your doctor, or if you need to, go to the emergency department. I don't generally recommend that, I don't like to push people to the emergency department, but try to, you can go to a freestanding emergency department, you can go to your clinic, call your doctor. It kind of depends on how bad you feel, but the best thing is prevention. So we talked about maybe staying indoors, we talked about wearing masks, we talked about, really importantly, staying on top of your chronic medications. Those are the things that people, I think, will keep them out of trouble. As preparation ought to keep you out of trouble down the road.
What do you anticipate going into the summer months? Like, is the heat going to make the haze worse or linger longer or anything like that?
So this haze that we're seeing today from the burning in Mexico and Central America, that'll stop because the farmers will stop doing that burning. But we do live in Houston, and there is a lot of petrochemical industry here. We got a lot of traffic on the roads. We get fires of our own from time to time, right?
Yeah.
And as the summer months get up, the chemistry of this does become a little bit more active, and so we can expect for people to have more trouble with respiratory illnesses throughout the summer. We see this every year, right? In the summers it gets hot. People with respiratory illnesses tend to have a little bit more problems, and it's generally because of the pollution in our air. Regardless of the source, it becomes a little bit more volatile just because of the heat.
Yeah, Dr. Persse, this is great information, and as always, a great topic to be talking to you about on this Monday morning. We appreciate your time.
Thank you, Haley.
All right, have a good rest of your day.